Hello, my name is James Pintus. I'm here to talk to you about using the bag valve mask, also known as the BVM. The BVM is a device that is preferred for ventilation delivery in cardiac and respiratory arrest. When used correctly, a BVM mask can deliver high effective ventilations while providing 90 to 100% oxygen. If used incorrectly, it may lead to ineffective ventilations, a deteriorating victim, and a waste of valuable time. Learning to use the BVM device takes practice. It is a very difficult task to accomplish, and it may be very difficult to perform effectively. You should be proficient in using one before you are called upon to use one in an actual emergency on a real-life victim. So when are they used? The BVM, or the bag valve mask, is used in the following situations. It could be used in the 911 pre-hospital setting for airway support for victims in respiratory or cardiac arrest. It could be used with children in a smaller size in respiratory or cardiac arrest. And it can also be used in coordination with ALS airways, such as the endotracheal intubation. What kind of equipment will we be needing? Well, first, we're going to be needing our oxygen tubing that connects to an oxygen delivery device, such as a oxygen tank. It could be a smaller D tank, or it can also be connected to a main tank. An oxygen source, suction if necessary, and then possibly a BLS airway, such as an oral or nasal airway of varying sizes depending on what the patient needs. We also need a mask that is appropriately sized for the patient. This is an adult mask. This is also an adult mannequin. And we will need the bag valve mask. It gets its name from the actual bag itself. It has a valve up here, a one-way valve, so that air can only enter into the patient. And then the mask itself. So when using the BVM, we're going to first need to position the patient's head in the appropriate position. Okay. If we suspect a neck or spinal injury, we're going to want to use the jaw thrust maneuver, which just involves us using the angle of the jaw and pushing in a straight up direction like this, as such. The next one, if we do not suspect a spinal injury, we can do the head tilt chin lift, 2 fingers underneath the chin and using the palm of your hand on the forehead and tilt the head backwards to open up the airway that way. And then we can use a BLS airway adjunct, such as a nasopharyngeal airway or oropharyngeal airway, to keep the tongue out of the way. Make sure that we size the mask. It needs to be properly sized so that it fits over both the nose and the mouth and creates a full seal on the face, so that anytime we provide a ventilation, the full ventilation enters into the lungs. It does not need to extend past the chin, and it needs to cover the cheek area. You may need to change the mask in order to obtain a good seal. Don't be afraid to try another mask to ensure that we get the proper seal. Okay, the first technique is a one-person technique. It is the most commonly taught technique, which is known as the EC method. The first one is we're going to want to use the nose as the landmark. That aligns right here with the tip of the mask. We're going to put that over the bridge of the nose, making sure that we get a seal along the chin. We're going to make our hand into the shape of a C, and that's going to go over the top of the mask and provide a downward force. The next is using these 3 fingers and creating an E on the jaw, on the angle of the jaw, in order to seal the mask. Okay, we can also use a technique where we offset the pressure by moving the bag to the opposite side of the patient to create an even force downward. Okay, so how are we going to deliver those breaths? The bag should be squeezed evenly and breath should be delivered over 1 second. The biggest thing that we want to see is chest rise in the adult patient. We don't want to squeeze too forcefully. That will cause air to go into the stomach. We don't want to squeeze it too quickly. Excessive breaths can lead to gastric inflation, which is bad, and can cause aspiration if there's too much air introduced into the stomach. We're going to deliver at a rate of 10 to 12 breaths per minute if the patient's in cardiac or respiratory arrest, and then we're going to slow down and use a rate of 8 to 10 breaths if the patient's in cardiac arrest or in coordination with CPR. Okay, and I will show you a quick demonstration on how we do that. We're going to tilt the head back and provide a nice even breath. As you can see in the lower half of your screen, we are getting good equal rise and fall of the chest. Okay, so it would be at a rate of 1 every 5 seconds. So you would squeeze the bag, 1 1,000, 2 1,000, 3 1,000, 4 1,000, 5 1,000. That is your basic introduction to use of the BVM. I highly recommend that you take the time to practice, both when you recertify your CPR card, as well as on your own when you're doing airway management. Again, my name is James Pintus. Thank you.